Before you start using Leuprolide, make sure to read the Patient Information Leaflet from your pharmacist. This medication is given by injection under the skin as directed by your doctor, usually once every 3 months. It slowly releases the medication into your blood over a 3-month period. If you are using this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional and the product package. It's important to properly mix the medication and check for any particles or discoloration before injecting each dose. Remember to change the injection site each time to lessen injury under the skin. Using this medication regularly will help you get the most benefit from it. During the first few weeks of treatment, your hormone levels will actually go up before they go down. This is a normal response to this medication. If you have prostate cancer that has spread to the spine or caused urinary blockage, you may require closer monitoring by your doctor, especially when you first start treatment. It's important to tell your doctor right away if you experience any unusual symptoms. Some common side effects of Leuprolide 3-month syringe may include hot flashes, increased sweating, tiredness, swelling of the ankles/feet, and dizziness. Rarely, shrinking of the testicles, breast tenderness/swelling, or reduced sexual interest/ability may also occur. It's important to talk to your doctor if you experience any of these effects. This medication has been prescribed because your doctor has determined that the benefits outweigh the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to tell your doctor right away if you experience new or worsening bone pain, increased thirst/urination, or mental/mood changes. In the event of very serious side effects such as symptoms of a heart attack or signs of a stroke, it's important to seek medical help immediately. A serious allergic reaction to this drug is rare, but if you notice any symptoms such as rash, swelling, or trouble breathing, you should seek medical help right away. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you experience any side effects, you should also contact your doctor for medical advice. Before using Leuprolide, be sure to disclose any allergies you have to your doctor or pharmacist. This medication may also contain inactive ingredients that could cause allergic reactions or other issues. It's important to discuss your medical history, especially if you have diabetes, heart disease, high cholesterol, mental/mood problems, seizures, or osteoporosis. Leuprolide can weaken your bones and increase the risk of bone loss if used for a long time. This medication may also affect heart rhythm, potentially causing serious symptoms that require immediate medical attention. Be sure to tell your doctor about any other medications you are taking and any medical conditions you have, as they may increase the risk of heart rhythm issues. Low levels of potassium or magnesium in the blood may also increase your risk, so be sure to discuss any relevant conditions with your doctor. Leuprolide may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid activities that require alertness and limit alcohol consumption while taking this medication. Before undergoing surgery, make sure to inform your healthcare provider about all the products you are using. This medication can affect fertility in males, so it's important to discuss this with your doctor. Leuprolide must not be used during pregnancy, as it may harm the unborn baby. Reliable forms of non-hormonal birth control should be used while taking this medication to prevent pregnancy. It is also not recommended to breastfeed while using this medication, as it is unknown if Leuprolide passes into breast milk. Always consult your doctor before making any decisions regarding pregnancy or breastfeeding while using this medication. It's important to be aware of potential drug interactions when taking Leuprolide 3-month syringe. This medication may affect how other medications work or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, Leuprolide 3-month syringe may interfere with certain lab tests, which could potentially cause false test results. It's crucial to make sure that lab personnel and all your doctors are aware that you are using this medication. Be sure to discuss any concerns with your healthcare provider. If someone has taken too much Leuprolide 3-month syringe and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important to remember not to share this medication with anyone else. Your doctor may also want to monitor your hormone levels and other medical tests while you are using this medication. Make sure to keep all of your appointments with your doctor and any required lab tests. If you have any questions or concerns about these tests, be sure to talk to your doctor for more details. If you miss a dose of Leuprolide, 3-month, syringe, contact your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. Taking this medication as scheduled is important for its effectiveness. You should store Leuprolide, 3-month, syringe in the refrigerator, but make sure not to freeze it. If you need to, you can also store it at room temperature in the original packaging for up to 8 weeks. Once you mix the medication, be sure to use it right away. Keep all medications away from children and pets, and do not flush them down the toilet or pour them into a drain unless instructed to do so. Make sure to properly discard this product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.